Hi, my name's Jen, and I'm a family nurse practitioner student from Simmons College. I'm going to assess your musculoskeletal system, cranial nerves, and I'm going to discuss your genitourinary system as well today.
Okay.
All right. So the first thing I'm going to do is assess your temporal mandibular joint. So I'm going to first inspect it. There doesn't seem to be any obvious deformities, nodules, erythema, swelling, or redness upon inspection that's appreciated. And now I'm going to palpate. So I'm going to wash my hands first, and now I'm just going to touch the sides of your mouth, okay?
Okay.
All right, so good. There's no swelling, nodules, erythema. Is there any tenderness when I touch right there?
No.
Okay, now I want you to open your mouth, close your mouth, jut your jaw out toward me, and then bring it back. And now I want you to clench your teeth. Good. There's no crepitus. Joint motion is very smooth, and there's no obvious deformities during palpation. So the next thing I'm going to do is assess your neck, and I'm going to start by palpating your cervical spine. And upon inspection, there's no obvious deformities that are appreciated, and there's no swelling, redness, or nodules that are appreciated upon inspection. However, do you feel any tenderness right there?
No.
Okay. I'm going to move down to the paravertebral area. Any tenderness right here?
No.
Okay, great. No nodules, no swelling, no erythema, no tenderness upon inspection and palpation. And now we're going to go over the range of motion of the neck. So what I want you to do is I want you to flex your neck forward like this, and then I want you to extend your neck back, and then you can look to the side and to the other side laterally. Great. And then rotate it like this. Awesome. So now I'm going to assess your shoulder, and I want you to first just sit right there for me. And as I'm inspecting the area, there's no visible deformities, there's no nodules, no redness, no erythema, and as the joint is stabilized in the joint capsule for the acromioclavicular joint, which is the AC joint. And this is a gliding joint. I'm going to palpate the bicipital groove. This is located between the two tuberosities of the humerus. And as I'm palpating this, there's no tenderness, right?
No.
There's no swelling, there's no obvious deformities, no nodules. And then the glenohumeral joint is the joint between the glenoid humerus and the cavity of the scapula, just down a little bit further right here. And no swelling, no erythema, no nodules appreciated upon inspection or palpation. That allows you to flex, extend, adduct, abduct, internally and externally rotate. So can you, as I'm inspecting and palpating, I want you to just be like a soldier and then go out like this. Great. Does that hurt at all?
No.
Alright, and now I want you to bring your arm behind your back. Does that hurt at all?
No.
And then in the front of you. Great. Nope. And now you can relax. That's awesome. And we're going to go over the range of motion of the shoulder. So I want you to take your arm and just flex it up like this, and down, and adduct, and adduct. Good. And now I want you to extend it back. Does that hurt at all?
No.
And then flex it forward like this, and rotate it back like that, and then forward. Does that feel? Do you feel any pain while you're doing that?
No.
The elbow. So first I'm going to inspect the epicondyles, medially and laterally. Do you feel any pain?
No.
There's no nodules, there's no obvious deformities, there's no redness, there's no swelling or erythema. Now I want you to flex your elbow and then extend it all the way. The joint glides very smoothly during flexion and extension. There's no deformities during that flexion and extension with the electron processes and the medial and lateral epicondyles of the joint during flexion, extension, or inspection and palpation. So now I want you to have your palms down, and I want you to try to roll them out like this. Good. And strength is a 5 out of 5. There's no nerve damage or muscle weakness that I'm appreciating upon inspection, palpation, and muscle strength tests. And now I want you to, against resistance, try to push me. Okay, 5 out of 5. And now I'm going to try to flex against you. Alright, that's good. There's no effusion, there's no deformities upon inspection and palpation of the bicep joint, flexing, extending in the tricep area, and the medial and lateral epicondyles. Wrist. So, for the radiostylide process on both sides of the wrist, the ulnar and radial styloids, and which is the bony prominence underneath the pinky, and then the bony prominence underneath the thumb. Does that hurt at all?
No.
In your snuff box, there's no deformities. Now I want you to do some range of motion exercises. So flex, and then extend, and then pronation, ulnar deviation, radial deviation, and then supination, pronation. Great. Did that hurt at all?
No.
Carpals of the wrist are the, can I see your hand again? Are here in this region. We have the middle of the hand being the capitate, the triquetrum, and the pisiform, the hamate, the lunate, the scaphoid, the trapezium, the trapezoid. And you can relax your hand. Assess your fingers. So there were no visible deformities or redness or swelling upon inspection, and the phalanges are all intact with no nodules or swelling or any signs of osteoarthritis or rheumatoid arthritis, and the metacarpals are all intact and free of any nodules or swelling, and as well as the distal phalangeals, the metaphalangeals, and the proximal phalangeals. Does that hurt at all?
No.
Can you go like this, this, abduction, adduction, flexion, and extension? Now, did that hurt at all?
No.
Great. Velocities. There's no visible deformities of the knee, no swelling, no erythema. Is there any tenderness when I palpate that?
No.
Okay, now I want you to flex your knee, okay? So I'm just going to bring it up. Flexion, and then extension. Great. There's no visible deformities or deformities upon palpation when I flexed or extended the knee. And now I'm going to have you, I'm going to talk about your ankles. So first I want you just to sit right there and let them dangle. And there's no erythema, redness, swelling, or any visible joint deformities upon inspection. During palpation, there is there's a medial and lateral The tibia I can palpate. The taurus, fibia, lateral meatus. And now I want you to flex, dorsiflex, plantar flexion, and now I want you to invert and then evert. Does that hurt at all when you do that?
No.
Okay, great. Now I'm going to inspect your toes. So, upon inspection of your toes, I have it right here. After I wash my hands, of course, I'm inspecting your toes, and I'm seeing that there's no visible joint deformities, there's no corns, there's no nothing that shows a red flag to me that there's something chronically wrong with your feet. And I'm going to just inspect the tarsal bones for the phalanges, and the tarsal bones right here, and the metatarsals. Sorry, are you ticklish?
No.
Okay. And you can put your foot down. Great. And now I want you to flex your toes up, flex them up, and then point them down, and then adduct your toes, and then adduct your toes. Great. So range of motion of the toes, there's no visible joint deformities, nothing that shows concern, no red flag. So first I'm going to go over the landmarks of the hip, which is the greater trochanter, right along the side right here. Does that hurt when I touch right there?
No.
Do you have any concerns with your hips at all?
No.
Okay. There's no visible swelling or palpable joint deformities as I'm palpating and inspecting the joint. Now I want you to, as I'm palpating the greater trochanter, I want you to take your leg and just abduct it out. Abduct. Great. Now I'm going to have you bend your knee, flex up, good, and bring it down over and up. Great. Does that hurt at all?
No.
Okay. And then you can relax your leg. And now I'm going to have you adduct it around here and down. Did that hurt at all?
No.
Okay. And now I'm going to have you stand up to extend your leg back and then forward. Does that hurt at all when you do that?
No.
Okay. And you can sit back down. Extended, flexed, internally rotated, externally rotated, abduct and adduct your hip. There was no pain or swelling, or joint motion was very smooth. And now I'm going to assess your spine. So first I'm going to go over the landmarks of your spine and your vertebrae. And I'm just going to palpate down your back. Upon inspection, there are no visible deformities. There's no redness, swelling, or erythema. No nodules that are palpated or inspected. Alright, and now I'm going to have you, and then just the sciatic notch right here. Right in under here. Does that elicit any pain for you?
No.
Okay. And I'm going to have you bend over for me as he's bending over. The paravertebral muscles, which I assessed before, are have no visible deformities. And I am looking at the angle of his spine, and upon inspection to the naked eye, it appears to be straight and negative Adams test. You can stand up now. Great. And you can turn around toward me, and I want you to flex your spine back, extend back, good, and then I want you to go from side to side, lateral movements. Does that cause any pain for you?
No.
Okay, great. And now do the same thing we did for your cheeks, and it's the sensory, where I'm going to do the sharp and the dull test. So we did sharp and we did dull, so you know which ones those are. And I want you to do it, I'm going to do it on different parts of your body, and I want you to tell me which ones are sharp and which ones are dull.
Okay.
So close your eyes and...
Sharp. Sharp. Dull. Dull.
And then let your legs go.
Sharp. Sharp. Dull. Sharp.
Great. So your light touch and your sharp and your dull are intact. Your vibratory sense with 128 hertz tuning fork is intact. We just tested that with your cranial nerves. And now I'm going to have you position for your great toe and your index finger. So I want you to tell me which one I'm touching and kind of do the same thing as we did before. So I'm going to have you put your hands out and close your eyes and tell me what I'm touching.
My finger. My index finger. My big toe. My big toe.
Okay, great. So your position, sense of great toe and index finger are intact bilaterally. Your light touch and your pain sensories are intact bilaterally, and your vibratory sense with the 128 hertz tuning fork is intact bilaterally. It's your gait. So I just want you to stand up for me, and I want you to put your heel to toe and walk that plank a little bit. Great. And now you can go back. Yep. So your heel to toe is intact, and your now I'm going to test, and your gait was intact when I saw you walk into the room. And now I'm going to test your Romberg. So I want you to stand straight up and close your eyes, and put your feet together. Feet together. And close your eyes, and for 20 to 30 seconds, I'm just going to see if you drift. Almost done. Alright, you're good. There's no drifting. That was appreciated during the Romberg test, which elicited a negative Romberg test. And I'm just going to test your coordination of your upper and lower extremities. So you can sit back down now. So I want you to just take your fingers and go like this. Good. So we tested your bicep strength, and we tested your upper body strength, and we tested with your shoulder strength. We and now I'm just going to test your lower body strength. So try to push up on my hands. Great, 5 out of 5 strength, and pull back. Great, and push forward. Awesome. And so 5 out of 5 for the upper and lower extremities for strength, and coordination of the upper and lower extremities was intact. And can I just have you stand up one more time? I'm going to have you do the nose test. So, yep. Good. Close your eyes. And now point to your nose. And point to your nose. Great. Thank you. I will first review my facility's policies and procedures of the male genitalia and what can be examined with whomever in the room, whether it be a nurse or an aide to do this examination. And now we'll start by first inspecting the genitalia for any visual deformities, rashes, erythema or swelling, any lice or infestations of any kind. and or visible deformities. If present, I will retract the foreskin and note any changes in the meatus or any drainage, and then I will palpate the meatus down and note any drainage if there is any on inspection or palpation. I will then palpate the shaft of the penis into the testes area and note any deformities or any nodules, and then I will then lift the testes and look behind them and assess the skin for any swelling, erythema, redness, or rashes, any drainage of any kind, and I will locate the epididymis and I will palpate that, and I will then end my exam. I'm going to assess your knee, so I want you to lay down on the bed for me. So as I'm just inspecting the knee, there's no nodules, erythema, or swelling upon inspection. Now I'm going to palpate your knee. I've washed my hands, and the femoral condyle and the tibial condyle and the medial and lateral joint spaces. As well as the tibial tuberosities. And now I'm going to have you flex and extend your knee. I want you to flex your knee and then fully extend your knee. Great. You can sit back up on the edge of the bed. And now I'm going to assess your deep tendon reflexes. So I want you to put your wrist out for me. And I'm going to assess your brachioradialis. Great. And now I'm going to assess your bicep tendons. Put your palm out like that. Great. And now your tricep. And now I'm going to assess your patellar and your Achilles. Great. And we are done.
Thank you.
So now we're going to do your mental status exam, and I want you to spell world backwards.
D-L-R-O-W.
Wonderful. And that tells me that your cognitive function is intact. And now I'm going to ask you, now why did you come here today?
For a routine checkup.
Perfect. So that tells me that your higher cognitive ability is also intact. Now we're going to assess your olfactory nerve, which is cranial nerve number 1. And I want you to close your eyes and tell me what you smell.
Vanilla.
Your olfactory nerve is intact. And now we're going to assess your visual acuity using the Snellen chart. And I want you to tell me the lowest line that you can see.
F D P L T C E O.
Perfect. Your visual acuity is 20/20. And now I'm going to assess your confrontation. So I want you to cover one of your eyes with your palm. And I'm going to cover my opposite eye, and I want you to tell me how many fingers that you can see.
2. 3. 2. 4.
Now cover your other eye. And I'm covering my opposite eye.
2. 3. 4. 2.
Great, your confrontation is intact. And now I'm going to do the fundoscopic examination and assess your retina. So I'm going to dial my diopter to 0. And I'm going to assess your right eye with my right eye. So bright lights. Positive red reflex. Visualizing the macula. Fundus appears orange-yellow. Blink a couple times. And now I'm going to assess your left eye with my left eye. reflex, visualizing the macula, the fundus appears orangey yellow. You had sharp margins and you showed no papilledema or signs of any problems with your eyes. So now we are going to assess cranial nerve number 2 and 3, which is the optic and ocular motor. We just assessed the optic, but we are going to assess them both together now. And I'm going to, again, shine a pen light in your eye. So I want you to look straight at me. I'm just going to dim the lights. So I want you to look straight at me. I'm just checking for pupillary response bilaterally. Great, and pupils are dilating equally and constricting equally bilaterally. And the patient has no signs of ptosis or drooping. Their eyes are uplifted and symmetrical movements with lids and blinking. So now I'm going to assess your extraocular movements, and I'm assessing the cranial nerve number 3, 4, and 6. Cranial nerve number 3 tells me your extraocular movements, and cranial nerve number 4 tells me your eyes are moving laterally, and cranial nerve number 5 is telling me that your eyes can move downward towards your nose. So I want you to look at the edge of my pen light and my ophthalmic scope and follow it with your eyes. Pupillary constriction on accommodation and extraocular movements are intact laterally and up and down, and no nystagmus was noted. And now I'm going to assess your trigeminal nerve, which is cranial nerve number 5. So I want you to just tell me if my light touch feels the same on both sides of your forehead. Okay? And now on your jawbone. Great. And now I want you to try to push my hands down with your jaw. Great. So cranial nerve number 5, which is the trigeminal nerve, is intact, and now we're going to assess cranial nerve number 7, which is the facial nerve, and I want you to wrinkle your forehead like that. Yep. And now I want you to smile. Perfect. So trigeminal nerve is, facial nerve is intact, and patient smiles, and all movements are symmetric bilaterally. Now I'm going to test your acoustic nerve, which is cranial nerve number 8, and I want you to repeat what I say as I'm rubbing your tragus of your ear, okay? So. Now I'm going to do the other ear. 1, 2, 3, ABC. Great. And the whispered test shows that the acoustic nerve is intact. I'm now going to do the Weber and the Renee test. So tell me when you can stop feeling it, and then tell me when you can stop hearing it. Great. So your acoustic nerve, which is cranial nerve number 8, is intact. Oh, and now I'm going to do the Weber test. So I want you to tell me if you can feel the vibratory sense equally on both sides of your ears. Great. And now we're going to move on to the glossopharyngeal nerves, and I just want you to say ah, and I'm going to look in your mouth with my ophthalmic scope. So say ah. symmetrical rise of the palate and the uvula. And cranial nerves number 9 and 10 are intact, and patient's gag reflex is intact. And now I'm going to assess your cranial nerve number 11, which is your spinal accessory nerve, and I want you to shrug your shoulders up against my hands. Spinal accessory nerve is intact, which is cranial nerve number 11. Now the last cranial nerve, which is cranial nerve number 12. I want you to stick your tongue out at me like this. Tongue protrudes midline and is symmetric bilaterally with facial movements. And now we're